Hey, Maya.
Hi.
Well, we'll see who else shows up here in a few minutes. All I'm going to do, I'm just going to kind of go through um, major points that you need to know for the test. And then
Okay.
I have like a little Kahoot thing that I did too, we can do real quick.
Okay.
Hey, Erica.
Good morning.
I'm just going to wait like another minute or two and see if anyone else comes, and then I'll get started. Hey, Delaney.
Hi.
Okay, I'm going to go ahead and get started. It's 10, and I have a final at 12:30, so I can't mess around here. Um, so basically, what I'm going to do is I'm going to kind of go through the test and kind of tell you important things to make sure you pay attention to. So, one of the things on the test has to do with jaundice. So, when babies have jaundice, um, you know how I think I said something about how my daughter Natalie had jaundice when she was born, and we had to take her back to the hospital and put her under the lights. So, phototherapy, that's something that they do for jaundice. So, what do you need to know specifically about putting a baby in under phototherapy? Is there anything like you as a nurse should be doing for that baby when they're under the lights?
Don't you have to turn and reposition them every 2 hours, I think it is?
Okay, that's one thing. What else?
Do you put something over their eyes as well? I don't know.
Yes, they have to have eye patches over them. And then there's one more thing you should know about that.
You have to make sure their eyes are closed under the eye patches.
Okay, it's not what I'm looking for, but okay. What other things are
Uh,
you concerned about?
You got to make sure that like genitals are covered. Well,
No.
that was all part of. Okay. Remove every 4 hours. Assess their skin.
No. So what it's looking for is you have to watch their intake and output really closely. So we're moving them frequently. We're putting eye patches over them, watching their intake and output, making sure that they're not getting dehydrated or anything like that. Okay. All right. Other things having to do with jaundice. Let me look through here real quick because I know there's something else on here about jaundice. Oh, here, let me look at it specifically because I didn't write down what it said. Okay, so this one, so there's a lot of selectols on here, okay? That last one we just talked about, that's a selectol. This is one as well. So it's just saying something about what are some things that are accurate statements about jaundice. So I'm going to read off some things and you tell me what you think is right and what you think is wrong. So breastfed babies have a lower incidence of jaundice. What do you think?
True.
Uh-uh.
False.
It's okay. Neonatal jaundice is common. However, I can't say this. Kernicterus is rare.
Yes.
That's, yes. What is kernicterus? You guys know what that is? Because that has to do with jaundice. That's another thing. Like on these tests, I feel like they put these huge words on there that you don't really understand what they mean. And then it's like, you know. So what kernicterus is, it's a type of brain damage that can result from high levels of bilirubin in the baby's blood. So it can cause stuff like cerebral palsy and hearing loss and all kinds of things. It can be really bad. So that, you know, when you read that statement, then you're going to say, oh yeah, a lot of babies get jaundice, but not a ton of babies get this, right? All right, what else? Jaundice is caused by reduced levels of serum bilirubin. True or false?
False.
False, right? Because we would have high levels. Appearance of jaundice during the first 24 hours or beyond day 7 indicates a pathological process. Do you think you would see jaundice after day 7 in someone still?
No.
Yeah, so probably this would indicate a pathological process if that was what you were seeing, right? Because typically you're going to see it early on. All right, because jaundice may not appear before discharge, parents need instructions on how to assess for jaundice and when to call for medical help.
True.
True, definitely. Which it's funny because I remember back when I had my daughter and they totally didn't tell me any of that stuff. But yeah, so that would have been nice. Okay, what else we got here? All right, do you remember we kind of discussed a little bit about shoulder dystocia? So this just means that as the baby's getting born, the head comes out okay, but once the shoulders are trying to come out, they get stuck. So there's a couple questions about this on there. There's one of them that says, which of the following would you not do for this, like as an intervention? So you remember in class, we talked about a couple of specific maneuvers that sometimes they'll try. Trying to think what else we said. Do you guys remember anything specific about that? Because that was in, I think, our last class we just did. We talked about that. So we may have to, some things you could do for this. Let's just say that. So things that would be okay to do for shoulder dystocia. So yes, we could do those maneuvers. So remember we mentioned McRoberts maneuver or Gaskin maneuver. Those would be things you could do. That would be something. Usually you as the nurse aren't going to do it. It's going to be the physician doing it. Another thing that you could try to help with this would be have the mother empty her bladder, because sometimes the bladder is too full and maybe that's part of the issue, get that out of the way. A third thing you could do would be to request assistance of additional staff to try to position the mother differently to see if you could get the baby to come out easier. So those would be good things you could do. Something you would not do is to tell the mother to push as hard and as long as she can, right? Because what the heck, what are you doing there? You're going to end up causing an injury, right? So what kind of injuries can you see if someone does have shoulder dystocia? Because that would be another question.
Can't they have a broken collarbone?
Yeah, so they can have a clavicle fracture. What else? There's a brachial plexus injury and also a neurologic injury that they can get from this. Okay, so moving on from that, there's another topic that's on this test. It's the biophysical profile. So when we talked about that, I think we talked about the biophysical profile compared to some other tests. Now, the biophysical profile includes what in it? What kind of test do you do?
An ultrasound
What else?
test?
What's that?
An ultrasound with a non-stress test?
Oh, okay. And what else? Anything else?
They measure amniotic fluid
Okay.
and like the fetal heart rate and movement.
Okay, perfect. All right, so you remember when you are doing this test, there are certain numbers that you assign to this. I'm trying to see if I can say this correctly. Hold on. Yeah, so you interpret your findings in a certain way. So we said, like, say you had a score of 2 or a score of 0, that would be horrible, right? So a good score would be 8 or above. And then scores that you would be a little bit concerned about would be like, a 4 or a 6. A 6, you would probably do further testing, but a 4, that would be, kind of bad. So remember some of those numbers associated with this. Okay, so we talked a lot about bleeding, postpartum. So if you had a postpartum hemorrhage, you're going to be at risk for shock. So hemorrhagic shock in particular. So just think back to, like, not even related to anything OB. If you're talking about someone who's going into shock, what kinds of things would you see associated with that?
Like a drop in blood pressure and tachycardia.
Okay. What else might be associated with that?
Change in level of consciousness.
Maybe. How about a decreased urine output? So as you get worse and worse with your shock, things are going to start shutting down, right? So if you have a decrease in urine output, that's a bad sign. Okay, so with this postpartum hemorrhage, what kind of medications would we use to treat this? There's like 3 or 4 of them that we mentioned in the chapter about that.
Like oxytocin and misoprostol and or however you say that. I think those are the two biggest ones.
Yeah, those are 2 of them for sure, and then there's another one called Methergine as well. So definitely know those meds because those are part of the treatment for postpartum hemorrhage. And then remember when we were talking about it, we said there was like a certain amount of blood loss that you would consider as being hemorrhage compared to just a regular normal amount. What would that be? Like it's normal to lose so much blood during pregnancy, right? When you have your baby. But
I think
what
it's,
would be considered too much?
is it like over 800 milliliters? Somewhere
Well,
around there.
like 500 is normal. So it'd be over that basically. Okay, let me think what else. Who's going to be at greater risk for a postpartum hemorrhage? What type of patient?
Maybe one who is induced.
Maybe.
You said at risk for postpartum, right?
Yeah.
Hemorrhage.
Yeah.
So someone that's had induced labor, exposure to oxytocin for longer than 24 hours. Anybody that like, if you had to have not a placenta previous, or what's it called when the physician goes in and removes the placenta himself, if there's fragments left over.
Oh, that subinvolution you're talking about.
Yeah.
So for this particular question, it's getting at like complications that you might see a mother have that's going to put her more at risk for this. So think about, someone who isn't like the normal person having a baby, like they don't have a normal pregnancy, they have complications going on. What would cause you to be more at risk for bleeding afterwards? So you're on the right track about the induction, because what med do we typically use to induce people with?
Isn't it like Pictonin or Picton?
Pitocin?
Yeah, that one.
Yeah. Yeah, so Pitocin, 9 times out of 10, that's what we use to induce people into labor, right? And what does Pitocin do to you? No one knows what Pitocin does?
It increases contractions.
Yeah.
The strength of contractions.
Yeah, there you go. Okay, the other stuff that goes along with this question. So who is at greatest risk for postpartum hemorrhage? Like they'll give you, 4 different options of people and you have to pick one. So the one that you're picking is someone who has complications. So it's going to be someone like who has preeclampsia, okay? So if you have preeclampsia, you have a high blood pressure. So if you have a high blood pressure, what's your heart is kind of working harder, right? Because you have all of this peripheral resistance going on through your vessels. So your heart's kind of working harder. So why would that make that person more at risk for bleeding?
They have a drop in platelets.
No, I'm not really getting at anything about platelets or anything. I'm just saying, you know, when you have high blood pressure, you are working harder, your heart's working harder to, you know, get your pressure, you know, under control, I guess you could say. So it's working harder. So as you have this baby, if you continually have this high blood pressure, if they don't really have it under good control, then yeah, you're going to be at risk for bleeding. So that's that one. So just kind of remember when you're looking at the options, you're thinking of someone who has more complications, not like your normal birth without any problems. Let's see. Okay, so remember when we talked about the VBAC, how someone can have a vaginal birth after a cesarean? You know how there's certain criteria that you have to meet to do that? What is that?
So if they have a vertical or T-shaped incision, then that will disqualify them from being able to do a vaginal delivery.
Okay.
I think that's one thing.
Anything else you can think of? Because this particular question has to do with the VBAC, and it's going to say something like, the nurse is aware that which patient information will likely disqualify this patient for having this VBAC.
If they've had multiple C-sections as well,
Okay.
I think that would disqualify them.
Because that scar isn't going to hold. I guess they're going to, your biggest concern is that you're going to have like a uterine rupture. What's something else though? You guys are forgetting something.
If the mom goes past her due date and like the baby's too big.
Well, yeah, that probably would be too. But what I'm getting at is pelvic abnormalities. So if this mom had a cesarean before and now she wants to have a vaginal birth, if she had the cesarean because she has some kind of problem with the pelvic abnormality, then yeah, you can't do this. You know, because maybe her pelvis is just shaped funny or something and the baby's not going to come out. So it has to do with that. So there's quite a few questions about like this postpartum bleeding. So make sure you kind of focus on that a lot. What's one of the biggest reasons why you would see postpartum bleeding? One of the biggest causes.
You're talking about after birth, after the baby is born?
Yeah.
Probably like the tone of the uterus, if
Yeah.
the uterus isn't contracting.
Exactly. So it'll be worded like uterine atony. Atony just means it has no tone whatsoever to it. It's just boggy and it's not doing what you want it to do. There is another term that I don't know if you guys know what the heck I'm talking about. Let me see if I can write it on the whiteboard and see if you know what it is. Let's see. All right, it's CHORIO, this is an A, sorry, MIONITIS. What is that? chorioamnionitis. What is that?
Is that where there is too much amniotic fluid or infection of amniotic fluid or something like that?
It's infection. Yes. So it's basically an intra-amniotic infection. But instead of just saying intra-amniotic infection, they're going to have this word here. So you need to know that's what that means. So both of those two things, having that uterine atony or having this type of infection inside the amniotic sac, is going to cause you to be at risk for bleeding. Okay? All right, what else? All right, remember we talked about inducing labor, and we said there's a few different ways that you can do that. So, of course, there's medicines you can give. You know, like we said, you would give Pitocin 9 times out of 10 to most people. There was other meds too that they listed that would help you induce labor. But what's a mechanical or physical way that you can use to help induce labor?
Like exercising or like having the mom walk around? Is that what you mean by like physical?
No. Remember in class we talked about this. It's you actually stick something into the vagina to like widen it. There's 2 different ways. I'm pretty sure this was in our last class we just had last week.
You're not talking like artificial rupture of membranes, are you?
No. Remember, one of the things was
Talking
like,
about-
oh, go ahead, Drew.
Are you talking about basically the forceps that the physician puts in that expands the?
No, not the forceps or the vacuum delivery. We're not talking delivery. We're talking like opening up the opening so that it's starting to progress. So this would be like, there's something, I forget exactly what it's called, but one of the things was almost like a Foley that you put in there and you just expand and you leave it in there for only so many hours and then you take it out and then they would already be dilated. This is someone who maybe is like not progressing really good or something, so you have to assist a little bit with this. Do you guys remember that now?
Yeah.
And I forget what there's another thing too, but those are mechanical or physical things that you could do to like open up that opening to help someone who's not progressing real well. So you have a specific question about that. All right, what's the purpose of giving betamethasone to a mom? Why do we give that?
It helps the baby's lungs develop faster because the baby's going to be preterm or something like that.
Okay. What specifically does it do to their lungs? So it stimulates fetal surfactant production. So you know how we have surfactant in our lungs? Like this baby won't have anything basically because it's so, not developed. So when you give this betamethasone, it helps to stimulate some of that production so it's not going to be so bad, as it's born. So just kind of keep that in mind. So typically you're giving this only to someone who you know for sure is going to give birth within the next 7 days. And this is, to prepare the baby for birth so their lungs are a little bit more developed. What's the purpose of misoprostol? What's that do for you?
It causes the uterus to contract, and but it causes it to contract, but like loosens the uterus.
It's not the uterus we're talking about, it's the cervix. It does something to your cervix, right? So you know how when you're getting ready to have a baby, when you're in labor, there's certain things that we're looking for. You know how we look how dilated someone is, the cervix does something, and then you have to have effacement. You have to have all three of those things before you're ready to have this baby to come out. So misoprostol you give to a woman to help ripen the cervix in preparation for labor induction. So it helps make some of those changes start to happen with the cervix. Oh, let me think what else. What does macrosomia mean?
I think it just means it's a big baby.
Yeah, exactly. So you have a specific question about that. Who's at risk for having a big baby? What type of mom?
A diabetic mother.
Yes. And then if you have a diabetic mother who has poor glycemic control during pregnancy, what are they at risk for? What's the baby going to be at risk for when they get born?
Is it hypoglycemia?
Well, yeah, you definitely are going to have to check the baby for hypoglycemia afterwards. You're right there. But if the mom doesn't take care of her blood sugar at all during the whole pregnancy and then the baby is born, you're at risk for having congenital anomalies with the fetus. So the fetus is going to probably have some type of problem when it comes out. There are a couple of questions that are specific to like complications that you would see. I'm going to talk about those next. So with a cesarean delivery, if you have someone that has to have a cesarean, what are some complications and risks associated with caring for a woman who has had a cesarean delivery? What kinds of things would you maybe see or maybe might see?
Blood loss.
Okay, so if they had a lot of blood loss, they'd be at risk for hemorrhage, right? So yeah, that would be one. What else?
Infection.
Well, they had a C-section, so what are they going to be at risk for?
Dehiscence.
Yeah, so wound dehiscence for sure. That's another one. And then there's two more that we need to think about. Think about like after surgery, are you able to move around and do a whole lot right after you have your surgery?
Not risk for blood clots.
Yes. Yeah, because again, you're going to be kind of bedbound for a little bit after that cesarean because you're in a lot of pain and it's not real easy for you to move around. So you're going to be at risk for clots, specifically like PE, you know. And then there's one other thing that I don't know, maybe isn't real obvious in here, but urinary tract infections. You're going to be at risk for that as well. Why do you think that would be?
From the Foley.
Yeah, because usually they put a Foley in during that. So yeah, anytime you have anything in you like that, you're going to be at risk for infection. Okay, the other question that has to do with complications, it has to do with an obese person who is pregnant. So which of these would the nurse anticipate with an obese client? What would be some things that you might see as a complication? So it's going to be a couple of the same things we just talked about with a C-section, right? So the obese patient might be at risk for having a C-section. And then if they did have a C-section, or even before that, even, they might be at risk for wound infection. Any obese patient is always going to be at risk for wound infection because it seems like um, they have all of that extra weight on their skin, and it causes like incisions to want to open up and stuff. They just don't want to stay closed. What else would an obese patient be at risk for?
Maybe gestational diabetes.
Yeah, actually, that is a good one, but that's not one of the options here. What if, okay, so we're thinking someone's obese, so they're unhealthy. So what other things would you expect to see in an unhealthy obese person other than diabetes?
High blood pressure, so
Yes.
preeclampsia.
So, well, just high blood pressure in general. They don't have it written as preeclampsia, it just says hypertension. So yeah, you would be worried about that. And then another thing that we talked about with cesarean, remember we said you'd be at risk for clots? You're going to be at risk for clots here too. So thromboembolism. All right, is there anything that would be like a pre-existing factor that would make someone more at risk for having a big baby in the future? So if you had a big baby before, that would put you more at risk for having another one in the future. So like, I remember my grandmother had a baby that was like 10, 11 pounds. And so she would have been at risk for having another baby that big as well. So anytime you've had a previous birth that's like, you know, a real big baby, they're going to be concerned about that. Oh, let's see what else is on here. Okay, so that HELLP syndrome. What do you remember about HELLP syndrome? H-E-L-L-P. What kinds of signs and symptoms would you see associated with that? What do those letters stand for?
Well, I know one of them stands for like liver, something to do with like the liver toxicity, and the levels are off with that. I'm trying to think back and remember.
Hemolysis and increased liver enzymes.
Yep, and what else? There's one other thing. I think you mentioned it before when we were talking about something else.
Low platelet count.
Yeah, yeah. So that's what HELP stands for. So hemolysis, elevated liver enzymes, and low platelet levels. So just remember that because in one of the questions, it's just going to give you like a scenario with some of those things in it, and then you have to pick that out as your option. If you have HELLP syndrome, what could be some things that could happen to the fetus? You know, what would be like a outcome that you would be worried about?
Jaundice in the baby.
I mean, yeah, I guess that could be something, but that's not exactly what they're getting at. Like, think of bad outcomes. What's the worst outcome you could have? You know, maybe the mother or the baby dies, or maybe both die, right? That would be the worst outcome. So that's one of them. And then what would be some other things that you might be concerned about associated with HELP syndrome? Adverse prenatal outcomes.
DIC.
No. There's something to do with the placenta.
Placental abruption.
Yes, that's one of them. And then the third thing that you need to be worried about has to do with their kidneys. So renal failure could be the other thing. So on here, then you're going to have this question, which talks about outcomes, and then you're going to have another one that talks about, hey, what would I see associated with this? Let's see what else is here. Okay, if a mother has hypertension in pregnancy, what would be a complication that you might see with the baby? So don't you remember when you read about hypertension with moms? It talked about how a lot of times, you know, you have to deliver the baby prematurely because the hypertension is so bad, right? So prematurity would be a complication. And then also intrauterine growth restriction. So maybe they just didn't grow very well because of this hypertension that's going on. Okay, if someone has preeclampsia, what finding is of greatest concern to the nurse? Would it be a blood pressure increase to 138/86? Would it be a weight gain of 0.5 kilograms during the past 2 weeks? Would it be a severe headache and an epigastric pain? Or would it be pitting pedal edema at the end of the day? What would you be most concerned about? So first of all, the blood pressure of 138/86, is that bad?
No.
No. So you're going to rule that out. Weight gain of 0.5 kilograms, is that very much? And this
No.
is in a 2-week period.
No.
Yeah, so we're going to rule that out. The pedal edema at the end of the day, that could happen to any of us, right? You can get swelling at the end of the day from being on your feet a while, you know? So the one you're going to be concerned about is the headache and the epigastric pain. So the headache is saying, you know, you're associating that with a really high blood pressure, because usually when people have really bad blood pressures, they can get headaches and other things associated with it. So that's what we're going to be concerned about there. Oh, this is that other one I was looking for earlier. So remember when we were talking about jaundice and I mentioned that kernicterus or whatever? So that is a, kind of a severe thing that could happen if you didn't treat the jaundice, right? If a kid kept having this jaundice and nothing was done. So this says, which sign or symptom will the newborn display prior to the onset of kernicterus? So what kinds of things would you see the infant doing that would make you think, oh, maybe they're starting to develop this? Remember we said with kernicterus, it's like brain problems, right? So things that you're going to see the baby do would be they're not going to have any tone. So they're going to have hypotonia. They're going to be really lethargic. They're not going to do a whole lot. And they're going to have a poor suck. So like if you're trying to feed them or something, they just won't be able to do that at all. Okay, there is a question about postpartum depression on here, and it's specifically about reasons or things that might be a cause of it. So what would you say for postpartum depression? What could be some things that might make you have postpartum depression?
Hormones or stress.
Yeah, the hormone levels change, definitely. So that could be an issue. And then stress, yes, stress related to taking on a new role as a mother. And then what would the third thing be?
With like prolonged birth process or like trauma, I guess, during that.
Mm, not necessarily. Because in this question, when we're talking about postpartum depression, it's talking about this person's at a follow-up appointment a few weeks later after the birth. And so what could be some things that are causing their postpartum depression? So we already said changes in hormone levels and stress related to their new role as a mother. So the third thing would be fatigue related to, being up all the time with your baby, right? So those are things that could, contribute. I don't know if you guys read about this, but there's a question that has to do with like you're teaching a new mom about what they should do. Trying to see how this is worded. About feeding techniques, like you're trying to teach her the right way to do stuff. So it says, which statement by the client reassures the nurse that correct learning has taken place? So this is your options. I refrigerate any leftover formula for the next feeding. I burp my daughter during and after the feeding as needed. I warm the bottle in my microwave oven. Since reaching 2 weeks of age, I add rice cereal to my daughter's formula to ensure adequate nutrition. Which one of those things do you think is correct?
Or
Yeah, the burping one, right? Because so the microwave, they always say not to do that because you can make the milk too hot. Um, and then I refrigerate any leftover formula for the next feeding. That's not going to necessarily be good. There can be bacteria and stuff in that. You just want to get rid of it. And then the rice cereal at 2 weeks, that's crazy. You'd be causing all kinds of problems at that point. All right, and then we talked about breastfeeding. Like we talked about some things that would be beneficial things to help you with breastfeeding and things that would be limitations to breastfeeding. So what would be some benefits of breastfeeding?
increase in baby's immune system.
Yeah, definitely. What else? So these tests are always like really right by what the book says. So if you look at this in the book, there's a whole list of things, that are benefits. So just make sure you pay attention to those. Like, you know how it gave like benefits to the baby? Like, what's a benefit to the baby of breastfeeding? Like, what would they have a decreased risk of if they breastfed?
Good.
Yeah, yeah. So sudden infant death syndrome, that would be decreased if they breastfed. What else? Is there any other kind of like conditions that maybe they wouldn't get because they are breastfeeding?
Like GI problems.
Yeah, I think they specifically say gastroenteritis. Yeah, so they would have a decreased risk of that. So this is a select all, of course. So it says which statements concerning benefits or limitations of breastfeeding are accurate. So you just have to pick the correct statements. So hopefully you guys can pick those out in there. I will go over every one of them there. Another one talks about which statement is the best rationale for recommending formula over breastfeeding? Why would you want to recommend someone to do formula instead of breastfeeding? What would be some reasons?
Mastitis.
Okay. What else? Actually, I think they still want you to breastfeed even though you have the mastitis.
Addicts?
Okay. Because you have to think about what can I pass on to my baby, right? So if you are doing drugs or something, sure, that might pass on through your breast milk. So that would be a problem. So yeah,
HIV positive patients?
definitely. Definitely. So yeah, that's kind of the idea behind that question. You just need to think along those lines. Let's see. All right, so going back to that mastitis for a minute. What kinds of things would you see if someone had mastitis? Signs and symptoms.
Red streaking fever?
Okay. And remember,
Nipple.
okay. So remember, this is an infection of your breast tissue, right? So if you have an infection, is it tender usually?
Yes.
Yes. Is it warm to the touch usually? Yes. Is it red usually? Yes. So things like that, just think that way. You should be able to pick those out, no problem. All right. There is a thing about hunger cues. This has been weeks ago that we talked about this, but so it says you're educating a new mom about how to figure out if their baby is hungry. Like their baby should do these certain cues to tell you that yes, maybe that's what their problem is. So what are some of those things that the baby might do to indicate that they're hungry? What's an obvious one?
Like making sucking motions with their
Okay.
mouth.
Okay.
Crying?
Crying. Yeah, that's my obvious one. I thought everyone would say that. What else?
Bringing their hands to their mouth?
Yeah, so they could like even suck on their fingers or their hand or something like that. The other ones would be opening their mouth in response to tactile stimulation. So like if you're going like this, maybe they're opening their mouth. And then rooting would be another one. Okay, there is a whopping one question on circumcisions. and it's specific about the Gomco circumcision. What would be like an intervention that you would do after that procedure for this baby? So first of all, after they do a circumcision, do you think it's bloody?
Yes.
Probably, right? So we're probably going to want to clean that, right? So gently cleanse the penis with water. And then the thing is, we don't want, I guess what I'm trying to say, you don't want to rub on the diaper. So maybe if you put something on the penis like petroleum jelly, it's going to help so that you don't have irritation and stuff developing from that. Does that make sense? So, gently clean it, put some petroleum jelly on it with each diaper change. So it's nice and moist and it's not, having all that rubbing. What do we do for a decreased temperature in an infant?
Skin to skin.
Skin to skin is a good thing. What else can we do?
A hat.
Yeah, the cap, that's always a good thing because you lose a lot of heat through your head. What else could we do?
Swaddle.
Yeah, swaddle them. You can even put them, what the heck's that thing called? The ink, no, I don't want to say incubator, but you know what I mean? You stick them in that thing and it's warm. What is that thing called? Is it the incubator? Trying to think of the name of that thing. You know what I'm talking about, you guys?
Yes.
All right, there's another question about sudden infant death syndrome. What's our number one thing we tell parents to do to prevent that?
Have them sleep on their back.
Yes, which I think you'll all get that no problem, but believe it or not, this is a select all question. So there's two other things you're going to tell them, which I don't know if you'll get. So that's why I want to see if you guys know this or not. So what else should you tell them about like their crib? What should not be in their crib with them?
Stuffed animals or anything like that.
Yeah, so you remove any kind of loose bedding. Like a lot of people put bumpers around their cribs, like you would take all of that out, any stuffed animals, any loose blankets or bedding or anything. And then there's one other thing about tummy time. So believe it or not, that you would put your baby on their belly occasionally during the day as long as you're supervising them. And this is, for short periods of time because it's important that they are on their belly sometimes so they can kind of get the idea of getting the strength to like pick up their head and to roll over and do all those things. So tummy time for play is also very important. Okay. All right, and the other day, I think I talked to you guys about, like if an infant is in pain, things that you could do to help with that. Remember we talked about swaddling, skin-to-skin contact, sucrose, putting like some like sugar on their pacifier or something, stuff like that. Tell me about the Moro reflex. If an infant does the Moro reflex, what are they doing?
The startle reflex, where the arms and legs extend.
Yes. So specifically, when there's a loud noise or something, they are going to abduct and extend their arms. They're going to fan out and form a C with their thumb and forefinger. So that's the Moro reflex. What's the Babinski reflex?
When you stroke the bottom of their foot and their toes like fan out.
Yeah, definitely. What else? Do you guys know what polyhydramnios means?
A lot of amniotic fluid.
Yeah. Who would be at risk for that?
Patient with diabetes.
Yes, yes. All right. All right, remember we talked a little bit about diagnostic tests and screening tests, like the difference between those. Diagnostic tests are the ones that are going to like really tell you yes or no, you have this problem. So there's one specific question that has to do with that, and it's saying which one of the following is not a diagnostic test. So when back, you look through your notes, and back when we talked about that, we listed a bunch. And so you should be able to pick out, which one would be a diagnostic test, which would not. What puts someone in the high risk category of pregnancy? What makes you high risk?
Increased age.
Okay. What else?
Smoking or obesity.
Not necessarily. Obesity, maybe, yeah. They don't have it worded that way here, but yes, yeah.
Diabetes.
They don't have that listed here. So this question, it's hard for me to, I don't know how to say this. So they have like a whole scenario about this girl who's 24 years old. It tells you all these, significant things about her. And it says which characteristics places this client in a high risk category. So you're going to have to pick out from the scenario what would place her in a high risk. So think about things like drug and alcohol use. Sure, that would put you at high risk, right? The obesity, like you said, because they specifically say BMI in here instead of obesity. And then also, what if you had a history in your family of certain bad things, like cancer or diabetes or something like that? If you have a history of those things in your family, then you're going to be at high risk for having those, right? So that's kind of how you need to think about this question when you're looking at it. Okay, if you find, like, say you're on a postpartum floor and you're going to check this mom out and you find that she has a saturated perineal pad within 15 minutes, what are you going to do? What should you do for that?
Massage the fundus.
Definitely, definitely. All right, and there's a ROGAM question on here. So remember with ROGAM, you're always going to have like a RH negative mom and a RH positive baby. So that's the person you would give the ROGAM to. Okay, what would be something that you could do as an intervention to correct a boggy uterus that is displaced to like
Have the
one
patient
side? What's that?
instruct the patient to avoid.
Yes. Okay. I think that's probably good enough, you guys. I pretty much went through most of these with you. I'm going to put on my Kahoot real quick. You guys can do that real fast. There's some questions on here that might help you as well. This Kahoot, so when I make these anymore, they have like a question bank that you can just, instead of making your own questions, which is kind of nice. So I've just been doing that lately. So they may not be very like super specific to the test, but for the most part, I think they're pretty good. Let's see here. Okay, so remember, go to this kahoot.it, and then you just type in this number here. Anyone else playing?
Miss, I'm actually at work, so I can't play the game,
Okay,
but
that's okay.
I'm still listening.
I'm gonna go ahead and start it then. Okay, what's the most common reason for the performance of a C-section? So yeah, this is the thing. It says most common reason. Doesn't mean that it's, so you're not going to see fetal distress all the time. That's going to be like a really small percentage of pregnancies that you see. So the biggest thing that you see most out of all of these would be failure to progress. So this would be someone that you would like, they start to progress and they just seem to stop. And so you go ahead and move on to the C-section. Okay, a C-section may be recommended to a mother with which STI? That's gonna be HIV because you can actually pass that on to your baby through your breast milk. So definitely that. Okay, all of the following are side effects of mag sulfate on a newborn except okay, it's going to be the poor sucking reflex. So you can see respiratory depression, lethargy, and hypotonia with the newborn, but not that. Which of the drugs listed below is given in order to accelerate fetal lung maturity? Yeah, this is the dexamethasone. Okay, macrosomia is defined as what? This is a newborn larger than average. Okay, preeclampsia progresses to eclampsia when so this has to do with the seizure activity. So once that starts happening, that's when it's eclampsia. Okay, what are signs and symptoms of kernicterus? Remember, I read these to you guys. I don't remember. So hearing loss, seizure, and cerebral dysfunction. Remember, we said you could have brain damage from this. So definitely that one. Okay, what is the Moro reflex? So when they're startled, they fling their arms out and quickly retract them. What's the Babinski reflex? That picture kills me. Did you see that baby's face? That was funny. Okay. All right, what are the signs and symptoms of mastitis? So it's unilateral pain and hardness in the breast with a flu-like feeling. So you guys look at the picture here. If you look at the picture, sometimes you can get a clue on the correct answer. So see how the redness is only on one breast? Okay, how do you prevent sudden infant death syndrome? Place the baby on their back for the first year of life. Which lab values below are not indicative of HELLP syndrome? So things that you would not see. Yeah, so it's going to be the elevated white count because remember you had the platelets, the elevated liver enzymes, and the low hemoglobin hematocrit were all associated with it. So this is the only thing that is not. The difference between postpartum blues and postpartum depression is good. So postpartum depression is similar, but it lasts longer and it's more severe. Okay, RhoGAM is given when? So Rh negative mother, Rh positive baby. Okay, the most common cause of postpartum depression is what? Or excuse me, hemorrhage. So depression. Okay, so uterine atony, that's, where your uterus just has no tone, so you're gonna do all that bleeding. Okay, postpartum hemorrhage is classified as blank blood loss from a vaginal birth, where it's different vaginal compared to C-section. So vaginal is gonna be greater than 500. Okay, a symptom of postpartum hemorrhage would be what? Tachycardia would be your correct answer. So typically, if you're losing lots of blood, like when you look at these other ones, of course, decreased heart rate wouldn't be it because it would be increased. And then increased blood pressure would be decreased with all this blood loss. And the tachycardia would be correct. Okay, what's not included in a biophysical profile? The fetal weight is something that you do not include. The rest of it is. Okay, what are some of the benefits of breastfeeding? Yes, all of the above. Okay, last one. Interventions for a GOMCO circumcision include? Applying a Vaseline dressing for 24 hours. Okay, so hopefully that helped you guys a little bit. So as you keep studying for this, I would just make sure you pay a lot of attention to that postpartum hemorrhage. That's a big portion of this. And then also make sure you look at the mag sulfate stuff. There's a few questions on that. And I don't know if you guys feel that comfortable with that kind of stuff. So just, I tried to hit most of the questions with you guys. So I think you kind of have an idea. Also remember with the select all that applies, there's I would never do this, but these people that make these tests, some of these, they have every option as correct. So remember that could be a possibility. It's not every one of them, but there's a couple of them that might be like that. So when you guys have class on Wednesday, it's going to be Rosa Kovach. It's going to be with you guys. And I told her to be on at 8 o'clock so that Dana and Delaney can do their thing and then everyone else can show up afterwards. So once you guys are done, you don't have to stay on, you can get off. And then I will have your lecture on there shortly. I'm gonna see if I can work on that today and put it on there. So you guys can listen to that. Questions? Okay, hopefully that helps
Sounds
a little
good.
bit. All right, if you guys need anything, you can still get a hold of me in email, the rest of the week and next week. So if you need anything, make sure that you look at upcoming assignments, even though we have this little bit of a time off, you don't want to get, not have something done that needs turned in right when we come back or something. So make sure you're looking at all that. All right, have a good rest of the day, guys. See you later.
Thank you.
Thank you.